My name is Dr. Robert Klein. I am a wound care specialist, also a podiatrist, but practice wound care full-time. I'm from Colwell, New Jersey. My educational background is I attended the Rosalind Franklin School of Medicine, Scholl College of Podiatric Medicine in Chicago, Illinois, and then residency in Detroit, Michigan. I am a wound care specialist, so I practice treating diabetic foot wounds, people who have poor circulation, people who maybe had surgery and developed an open wound. I have a unique kind of skill set as I'm a podiatrist as well, so I'm trained in foot surgery. My practice is mainly focused on foot wounds, so I treat diabetic foot wounds, surgical wounds, traumatic wounds, adding both my skills from a wound care provider and as a podiatric surgeon. I've been practicing wound care for 30 years. I actually worked with a plastic surgeon about 30 years ago. He needed a podiatrist to come help do surgical offloading for his diabetic foot ulcerations to prevent ulcers from coming back. We formed this very collaborative relationship. It was almost like another mini residency. I wound up working within the wound care center in Texas where I was practicing at that time. And I found that wound care was much more gratifying for me than the podiatric side of my practice. It's much more fulfilling when we save a limb. And that's what really steered me to what I do nowadays. When you save a limb, you save a life. Education is a critical component to diabetic-related foot disease in particular, which is a real strong passion of mine. Diabetic patients run a real high risk of losing a foot or losing a limb as a result of a wound. So I sit down and talk with my patients at extensive lengths, especially when we get a wound closed. We talk about treatment all along the process beforehand, but once we get the wound closed, we need to educate them how we prevent getting another wound so they don't wind up with maybe a lost toe or a lost foot or a lost limb. So I spend a lot of time with them talking about the statistics nationally, the statistics of diabetes as well within South Carolina. South Carolina is unique in such that we're in the diabetes belt. We have a higher incidence of diabetes in South Carolina than nationwide. So education is a really critical component to what I do within my practice. When I'm not at work, I love to spend time with my family. I've got a wife and 2 kids. My son is a submariner in the United States Navy, soon to be deployed overseas, so spending time with him is really important. And my daughter is a senior in college at the Naval Academy, soon to be either a submariner or a surface warfare officer. So for me, with my kids serving and possibly 1 abroad or maybe 2 abroad, spending time with my family is certainly number 1. Otherwise, I like to spend time with my wife, my kids, swimming, biking, and running, and hiking our beautiful trails in South Carolina. To make an appointment with me, please use the information on my profile page.